Hey, welcome back, my friends. My name is Danny Dumas, and this is the Earn Your Title podcast. The past few podcasts have been kind of heavy, a little more abstract. So today I wanted to give you some concrete things that we could work on as the spring is starting and we're going into summer, hopefully soon. We're going to talk about first aid. If you're new to the show, I have been a firefighter paramedic for the last 25 years, and I've been teaching the American Heart CPR first aid class for about 15. I do feel knowledgeable in this category. And this is not going to be the American Heart class. I'm not endorsing that. And I also would say this is not a training class. You should not be getting your sole information from a podcast. First aid is a skill that you should practice. It's a hands-on skill. But I did want to give you a little bit of knowledge. And this is going to be a three-part series. I'm going to break it down into trauma, medical emergencies, and then environmental emergencies. And I'm going to try to stick to things that you can control. You know, you could, if you have abdominal pain, and it could be very serious, that could definitely be a medical emergency. And as a first responder, there is nothing you're going to do. Even as a paramedic, we start IVs, maybe we give pain management, maybe, but that's about it. So I'm going to stick to the emergencies that you could have equipment with you and fix those emergencies, or at least the knowledge that you could enforce or the knowledge you could share with somebody else could save a life. So we're going to start off talking about traumatic emergencies. And before I do, I want to say that at some point in your life, you're going to experience trauma, or someone in your life is going to experience trauma. What does that mean? It means something physical is going to come in contact with you or a loved one and cause damage. That is the very general definition of trauma. Something hits you, pushes you, you fall, you come in contact with the ground or a brick or, something sharp or pointy or, something, you get a hole in you. And it's going to be, there's some things we can do that are going to fix those problems. And there's some things that you need to have with you in order to fix those problems. And we're going to talk about tourniquets. We're going to talk about bleeding control. And a lot of times, I live in a world, as a firefighter, where violence is a real thing, and we're exposed to situations that are intense with potential for violence. So I definitely think about this, but I know a lot of people don't. And I think I might have shared this story with you, but one of my best friends, he is not in a world that deals with violence. He is a mortgage broker and a pastor, and he was driving home from dinner when a random person shot up his car. It was just literally a random drive-by shooting. His car was hit with multiple bullets. He was actually fine. He had no injuries. But his cousin, who was driving in a car behind him, his cousin and his cousin's wife were both shot, and they were hit several times. And he didn't have any equipment because he doesn't live in that world, he's a mortgage broker. That's just not the world you live in, where you potentially could be driving down the road and get shot. He didn't have any tools to take care of the problem. And so it was actually his birthday just a couple of days later, and I sent him a tourniquet. I sent him a chest seal. So if you're thinking, I don't live in that world, we all live in that world. As long as we still have gravity, you live in the world where there's a potential for trauma. As long as you're driving in a car, you live in a world where there's a potential for trauma. So step one is coming up with the mindset that bad things can and will happen to you. And this is not to be scared of it. It's not to be, going on worrying. It's just to be prepared. And when you're prepared, you're less worried because you know that you can handle your business. So step one is to realize that there's going to be some emergency in your life, and it's trauma related. It could be as simple as you're cutting food in the kitchen and you cut your finger. Is it trauma? Yes. Is it life-threatening? Probably not, but you'd want to have the tools. So that's step one, have the right mental mindset. Step two is you're going to need to be willing to break the bystander effect, meaning when you see a problem, you have to be willing to take action. I see this a lot where lots of people know something bad is happening and everybody stands around and waits for someone to do something. Well, I'm telling you right now, you are somebody. I want you to have the first responder mindset where I can take action. I can do something. I can be the person that makes a difference. One of my favorite movies is Field of Dreams. And there's a scene in the movie where all the baseball players, they come out of the corn and they're playing baseball, and one of the kids in the stands starts choking. And you see a baseball player run up and he gets to the foul line, the out of bounds line. And he looks down at it, and he looks at the kid who's choking. And he steps across that line, and he goes from being a young, vibrant 20-year-old to an elderly physician with his old school leather bag. He goes over there, and he stops the choking. He does the, back slaps and the Heimlich, whatever. The kid stopped choking, but he turned into the doctor who he was going to become. And while, it's just a movie, I think it's an important lesson. At some point, you have to cross the line and become the first responder. So step one is getting the right mindset, that you are not just a witness. You're not just recording it on your phone, that you can make a difference. And at the end of this podcast, I feel confident that you'll at least understand what to do. Now, you might not have the tools yet, and you might not have practiced, but you'll have the knowledge of what to do. So step one, and we're going to talk a lot about bleeding, a little bit about head injuries. Major bleeding is a cause of death. It could be from, an accident, you're cutting with a chainsaw in your yard, you're shooting your bow, you're carrying your CPL and you accidentally shoot your leg. Many reasons could cause major bleeding. And there's 3 places where you can have major bleeding: your limbs, your junctional areas where your limbs go into your trunk, your body, and then your body. And your body's kind of divided into 2 spots: your chest, where you breathe, your lungs are, and your guts, where your stomach and colon and kidneys and liver, all the major organs are. So we're going to start with major bleeding to your extremities. Now, there's usually a progression, and it leads up to tourniquet. So we're going to start at the most simple. You are in your backyard, a storm came through, and some tree branches have fallen down, and you're cutting with your chainsaw. The chainsaw kicks back, or the chain rips off, and you cut your forearm. Or maybe somebody else. Let's pretend like it's somebody else. You're with your dad cuts his forearm. He is now bleeding. 2 kinds of bleeding. Dark red blood is usually venous bleeding, and it's slow. It's kind of leaking out of the body. Bright red arterial blood is under pressure. Every time your ventricles squeeze, it shoots blood out of out into your arteries. And when your arteries are cut open, it shoots out into the atmosphere. So anytime you see splurting blood, that's the emergency. You could technically bleed out from venous bleeding. Probably not going to happen. Not a lot of pressure, easier to control. But arterial bleeding, lots of pressure, and you can run out of blood, and it's a finite resource. So step one is going to be direct pressure. And if it's somebody else, I would encourage you to have them put the direct pressure on the wound. So they cut their forearm. You tell them, hey, listen, I want you to take the cut and push on it really hard. Now, the good thing is most times you don't have to tell people to do that. There's something built into humans that when they're cut, they grab a hold of it. If you ever cut your finger with a knife, cooking, you instantly grab it. And it's really weird. As long as you don't look at it, it usually doesn't hurt real bad. Once you look at it the first time, then the pain comes. But you're going to tell that person, hey, direct pressure. And that is your first line of defense, direct pressure. The next thing you want to do is you want to put something that absorbs blood. In the medical terms, this is gauze. You're going to take gauze, but this could be anything. It could be a clean t-shirt. It could be your sweater. It could be paper towel, something that will absorb blood. You're going to take that and you're going to put it on the injury, on the cut, and then you're going to hold direct pressure on top of that. So you've got direct pressure to start. If that doesn't work, then gauze with pressure on top of that. And this is what's important about gauze, or absorbent material, if you want to call it that. Don't take off the lower levels of the gauze. Whatever is touching the skin, the first few levels or layers of that gauze, keep those on. When our body senses that it's cut and it's leaking, it sends clotting factors to our blood that tell them, hey, start getting sticky. What that sticky blood does is it closes up the hole. If you continually remove the bandaging material, the gauze material, you're taking the clots away. And the clots are what's going to make that hole close up. So we want to keep the lower level, the closest level to the skin, in contact. Now, if you've got 6 layers of gauze that's still bleeding through, you can take some of that off if it's making it hard to bandage. But gauze, keep it there, keep it bloody. You want the blood to be in contact with the skin. Then direct pressure. So you maybe you tore off your t-shirt. That's the pressure. You want to get some more tools. So you're telling the person, hey, you're cut. If you feel like they can't move, set them down so they don't pass out. If not, have them come with you to where you have more tools. Let's say you have first aid kit in your car. So you tell them, hey, quick, pressure, gauze, I'm running to my car. While they're doing that, you can also have them elevate their arm. Getting your arm above your heart lowers the blood pressure. When you have an arterial bleeding, it's under pressure from your heart. By raising it higher, gravity makes the pressure less. So we've got direct pressure, we've got gauze, now we have elevation. The other thing you can do is if you don't want to put your hands on, say this is a stranger and you've got cuts on your hands and you're worried about, infectious diseases, which could happen, but in reality, it's probably your risks are very low. You can do pressure points. So if it's in your lower arm, if you feel in your upper arm where your pulse is on your humerus, which is your upper arm bone. So if you pretend like you're going to take a picture and push your muscles up to make them look big, that motion, you should feel your pulse. Where you feel your pulse is where you should feel your victim's pulse or your patient's pulse. Push right there too. That can also decrease the amount of flow to the arm. If it's in your legs, where your hip meets, where your thigh meets into your pelvis, you have your femoral artery. This is a little bit harder to push, but you can take your hand, push it in there, and that can slow the bleeding down in your leg. So we have pressure, gauze, elevation, pressure points. You still have bleeding. This is where you have to apply a tourniquet. Now in the movies, I know everybody whips out their belt. They get their belt tight, and if all you have is a belt, great, use the belt. More than likely, you will not be able to get the belt itself tight enough by just using it like a belt where it puts it through the loop and you cinch it down. One, there's probably no holes that far enough down that when you pull it tight, it gets around someone's arm. There's no hole to stick it through. So you're not just going to be able to get it tight. And more than likely, just by pulling on it, you won't get it tight enough to slow the bleeding down. So what you do is you're going to use something called a windlass. For you non-medical people, this is called a stick. You're going to get the belt on at some degree of tightness and get a stick in there and start twisting it. And that's going to create the tourniquet effect, and it's going to shut the blood off. Now, what I recommend and what I have throughout my house is to get a commercially made tourniquet. I've got several different kinds. The North American Rescue tourniquet is I believe it's called the CAT, is what the military uses. I have those. I also have one that's called a rat's tourniquet, and I have it kind of looks like the binding of a ski or a snowboard boot where you click it and it makes it tight. The tourniquet style with a windlass, what the military uses, is the most researched and studied, but I think as long as you feel comfortable and train with it, use what you feel comfortable doing. But you're going to put a tourniquet on. The only way you're going to have a tourniquet is if you've bought one and staged them. So for me, I have one in each car. I have one in my backpack that I carry with me everywhere I go. I have one next to my table saw. And the idea is I'm having them in places where bad things could happen. Think about your life. Where are you going? What are you doing where you could come in contact with trauma, with force, with sharp objects, and then stage one there? When I teach it, I've bought the tourniquets from Amazon. I think they're like $6 or $7 a piece. Now, I wouldn't want to use that to save my life, but I feel pretty confident it would. So get these tourniquets. The good ones are $25 to $30, but if you can't afford it, go get some cheap Amazon tourniquets, and I think they'll probably be fine. Probably made in the same factory, who knows? But when you're going to apply a tourniquet, if you were in the military, they would tell you high and tight, meaning if it's anywhere on the arm, you're going to go up by the armpit, get it as tight as you can by pulling on it, cinching it down, Velcroing it down, and then start spinning the windlass. High and tight. If it's on the legs, up by your groin area where your legs come into your pelvis, high and tight, getting it tight. Now, if you have a little more training, you just need to be a couple inches above the injury. So if it's on like the wrist, you can go into the middle of the forearm, crank it down there. That would be just as good. But if you have no training, all I want you to remember is high and tight. Getting up on the joint, near the armpit or near the groin, get it tight and then spin it. This is the hard part. You're going to spin the tourniquet or the windlass until the bleeding stops. Unfortunately, it's probably going to be painful. They're going to be saying, stop it, stop it. Second last time I put a tourniquet on, a guy was shot in the legs, and we had tourniquets on his leg. He was taking them off because it hurt. And I understood. I'm like, sir, you got to leave these on. He was bleeding all over, but the tourniquet itself hurt. We had to highly encourage him to stop because he was losing blood, and he wasn't making good decisions because he had lost blood. So get it on, tell them, hey, this is going to hurt. We have to stop the bleeding. Spin it on, get it tight, and once the bleeding stops, that's tight enough. Now, let's say it doesn't work. You've got it as tight as it go, and there is a limit to how much you can spend the windlass. If you have another one, throw another tourniquet on and put 2 on. 25 years ago, when I started my paramedic program, they kind of told us like, hey, if you use a tourniquet, we're going to cut their limb off if it's on for any period of time. That was the prevailing thought. And then the war in Ontario happened. Unfortunately, a lot of our soldiers lost limbs, and they put lots of tourniquets on, thousands of tourniquets, and they studied it. And up to 2 hours, you can have a tourniquet on a limb, and really, it can be fine. So put a tourniquet on. Do not worry about it. There's a spot for time where you would write what time it is. If it's just you or a family member, that's probably not a big deal. Get a general idea. It's roughly noon. The time thing in writing on it is when you have 10 victims, like an active shooter or something. You've got all these people. You're not exactly sure, and you're not going to go with the patient to the hospital. That's when the time is important. But get it on, get it tight, get the bleeding to stop. And I don't want to say the encouraging part about this is that you can save a life. Having a tourniquet literally will save someone's life if it's a bleeding in the limbs. Unfortunately, not all injuries happen in the limbs. You might have some major bleeding in your junctional areas or kind of your joints where your arms go into your chest and when your legs go into your hips or to your pelvis. We can't get above the artery because I guess I didn't explain it. What a tourniquet is doing, it's squishing the artery up against a hard bone or a long bone, allowing the blood to stop right there. So the bone and the artery are crushed together so blood can't get through. You're overcoming the pressure of your heart. Well, in your joints, we'll call it your armpit, there's no way to get above the artery, so you really can't crank down a tourniquet to stop it. So what do? You're going to do what's called wound packing. And it's just what it sounds like, and it is very unpleasant, and this also hurts. The last time we did wound packing, a guy got shot in the groin, and we take gauze material, and you shove it into the hole. If you've ever seen an old World War II movie or maybe any war movie, someone gets shot in the gut, and they'll take dirt and they pack it into the wound. That's the same idea. It's just more sterile to have some type of gauze material. And they sell gauze material that's specific for wound packing. It might come in like a square package, and it's all linked together. So as you're holding it, with your fingers, you're shoving it into the wound. You're filling up that cavity where whatever caused the hole created, and you're building pressure up. Now, some of the material will have a chemical in it called, the common name is quick clot, but there's different types of material. And basically it helps the blood clot faster. So you might have some material that has that, but if you don't, it's okay. You're shoving material into the wound, and this is also going to hurt. And then after you do it, this is also important. You still have to hold pressure. So if it was in someone's shoulder and we call 911, where you pack the wound, I might kneel on it with my whole body weight or put my hand on it like I'm doing CPR, but just hold the pressure because I need to hold the pressure to stop that bleeding. Again, these are going to hurt, but you're going to the fact that if we don't do something, they're going to die. And that's when it's okay to hurt people, because if you don't hurt them by treating them, they're going to die. So these are really serious injuries, and we're going to treat them very aggressively. And mentally, this is a very tough thing to wrap your mind around. And when it comes to, being a first responder, a lot of it is mental. Just knowing the right steps to take, knowing that sometimes this might not be a comfortable thing for anybody. It could gross you out, but be willing to say it's worth it. It's worth it to hurt these people by doing something that is gross. Sticking your fingers into a wound in someone's body is not pleasant, but it is so important. Now, again, these are things that you should practice. You should practice applying a tourniquet. You can practice wound packing. I took these like rubber dog toys. I cut them open. It's just kind of a hard rubber ball, and I'll stick it on someone's shoulder, and I'll say, hey, they got shot in the shoulder, and they shove the wound material into that dog toy that's in their shoulder, and then they put a bunch of weight on it. There's things you can do to help practice, but you got to have the tools, and you got to be willing to use it. The third area where you can have major bleeding is in your trunk. Your trunk is divided into your lung area above your diaphragm and your gut area below your diaphragm. In the lung area, it's too big to wound pack. You couldn't really shove gauze material into your lungs. It's too much room. You're not going to stop the bleeding there. Usually what the major problem is with chest injuries is when your lungs collapse. And so there is another tool that I think it's important to have, and it's one of the things I carry, and I don't have it by my table saw, but I have it in my cars and in my personal first aid kit in my backpack. It's a chest seal. We don't want air to go in or come out, really, our chest wall, right? The air should be in your lungs, and it shouldn't be going in and out. Once you get a hole in your lung or in your chest wall, there's a potential you get a hole in your lung. And there's a couple things that can happen. The hole in your lung can leak air out into your chest wall, but not out of your chest, not into the atmosphere. And what happens is that as that builds up, you are putting pressure on your lungs, and that lung is collapsing. You hear it called a collapsed lung or a dropped lung, and that's bad. We need our lungs inflated. So one of the things, the other things you can do is as you're inhaling through your lungs, it can suck air from the outside into your lungs, also causing that collapsed lung. So what we do is we put a chest seal on, and usually chest seals come in two. You have two chest seals, because if there's a hole going in, there's probably a hole going out. So both holes, you put a chest seal on. One or both will have a vent. And what this means is that if the air is trying to come out, it allows it to. So it's leaking out of the lungs, it's going through the hole, and there's a vent, and it lets the air out. But as you breathe in, that vent gets sucked closed, and it doesn't allow air to get into your lungs. So that is an important tool to have. So having chest seals for penetrating chest trauma is important. The next area is going to be your below your diaphragm, or kind of like where your ribs stop and you have the soft of your abdomen. Not much you can do there. You could try to hold pressure. Again, it's a big cavity. You can't really wound pack very well there. And so that's transport them to the hospital. And with all these, get them to the hospital as quickly as possible. That is the priority. We just, even in the emergency room, if somebody has any penetrating chest trauma, a bullet or something went into somebody, especially in the guts, the only really definitive treatment is exploratory surgery. If someone gets shot in the gut, they're going to open them up and they're going to look at each organ and make sure there's no holes in them. That's about it. And then when they find holes, they're going to suture them up. So getting people to the hospital quickly for any arterial bleeding, super important. That is the main trauma that you can fix as a first responder is bleeding. If someone breaks something, finger, leg, the big key is you want to try to keep it stable, especially if they're big bones like your femur. Your femur, if it breaks, it can get sharp, jagged edges. And that femoral artery that I talked about that we're going to clamp down with the tourniquet, if that jagged part of the bone cuts the femoral artery, you could die. You could die from a broken femur by cutting your femoral artery. It can be a big deal. So the big key is to keep it stable. You don't have to get super fancy with a pre-made tourniquet or anything like that. You just want to keep it from moving. If it's simple as like a broken finger, you could tape the bad finger to a good finger, and now you have pretty good control over your good finger, and you won't move the bad finger. People that break their collarbone, they'll grab their arm and stick it close to their body and hold it up with the other arm. Just keep it in the position that they want it. They're going to put it into usually the most pain-free position. Every now and then someone will break something and their arm gets stuck in a really weird spot, and that actually feels good, like up and over their head. They're going to put it there. They're going to figure that out. It is hard for us to transport them when their hand is up and above their head. We just do our best, putting pillows underneath it to support it so that their muscles aren't holding it up. One common myth when it comes to broken bones is that if you can move it, it's not broken. That we don't really work like that. We're not a mechanism in the sense that like if a piece falls off, the whole thing stops functioning. You can move your arms or legs and be completely broken. You're just moving an arm or leg, because what happens is your bone breaks, but your muscles can still contract. Now, if it's completely snapped, you probably can't move your arm as normal, but you could still move it because your muscles are still attached to both ends. So I've heard people say, it's not broke because you can move it. That's not true. If you think something's broke, go get an x-ray. They can fix lots of broken bones, pins or rest. There's lots of things they can do, but don't move it. Be comfortable. There's been a lot of changes in how we deal with spinal cord injuries. In the past, if you had any type of neck or back injury, any kind of fall, we would put you on a backboard, put a collar on your neck, strap you down, and not let you move. It's probably been 5 or 6 years ago, maybe 7, 8 years ago now. They've changed that. if someone has a suspected neck injury, we still have them put a cervical collar on to keep their neck from moving. But besides that, we let them get themselves in a position of comfort. If someone's in a car accident, we think they hurt their back, we put a C collar on, then we let them stand up and sit on our stretcher, not on a backboard, on the soft stretcher. They're going to keep themselves in a position of comfort. Their body has a natural protective instinct to not move in a situation that hurts. So we're letting them do that. Plus the backboards are super uncomfortable. If you didn't have back pain before you're on the backboard, after 2 hours of being on a backboard, you will have it. So with neck injuries, we want to keep their neck still and stable. But as far as getting them to a position, if they feel much more comfortable sitting in a chair, we're going to let them sit in a chair. If they feel more comfortable laying on one side or the other instead of flat on their back, we're going to let them put themselves in a position of comfort. So I think that one, it's better, it's helpful. Humans in general want to be comfortable. Letting them get into a position that's comfortable probably is the best position for them. So that's any type of break. Someone might get whacked on the head. A big concern is concussion, and then an even bigger concern would be something like a hemorrhagic stroke, which would be bleeding in your brain. And we'll talk a little bit about that at our next podcast when we talk about major medical emergencies. But hemorrhagic stroke, instead of a blockage, there's a leak in your brain. When you have a brain injury, our skull is a sealed container. As the pressure builds up, it squeezes our brain and causes weird things. If you have anybody who gets hit in the head and all of a sudden they're confused, their personality changes. Maybe they're normally a really kind person. Now they're an angry person. They start having physical deficits such as a drooping face, difficulty speaking, difficulty holding up one arm or the other. That is a time to go to the emergency room for sure. They might have to remove a piece of their skull to let the pressure off. There's lots of things they can do, but you got to go quickly. So any change in mental status. Another big sign is if you look at someone's eyes and one pupil is really small and one is really big, that is a sign of a brain injury. Now I have a funny story. We're on a fire engine and we went to an accident and there was a guy out of the car and we thought he got thrown out of the car. He's on his side, he rolls over and I look at his pupils and one is tiny and it's really bright out and the other one's blown out. So just so you know how your pupils work, when it's really bright, your pupils constrict to limit the amount of light into your pupil. It's just how our bodies work so that we don't get blinded by the sun. One was really small, one was full size, big. So I get on the radio and I tell the ambulance, hey, we have a priority one. When you get here, we need to go right away, thinking this guy has got a hemorrhagic stroke or he's got a brain bleed. And they get to the hospital. We finish up with the car accident, and I see the crew later on. I'm like, hey, how'd that guy go? It looked like he was having a brain bleed. And the guy started laughing. He's like, nah, he was actually just drunk. He didn't get thrown out of the car. He crawled out of the car. And I'm like, oh, really? Well, wow, that's crazy. One of his pupils was all blown out. I was like, yeah, he had a fake eye. It's like, God, got me. I totally missed that one eye was fake, which is explained why it didn't contract or dilate. So sometimes you miss that stuff, but better overtreat, right? So that is the head injury. The other one that's an emergency. Concussion. It's kind of like your brain scrambled. It could lead to a brain bleed, but you don't really know. So with concussions, the big one is just mental status. Are they responding normally? Visions are probably a good second. Is their vision messed up? If you have a kid that gets whacked in the head, there's a common thought, and it's not necessarily a myth, that going to bed is dangerous. So say your kids are playing, it's late, it's 30 minutes before their bedtime, they jump off the bed, they whack their head on the floor or something, and you're like, don't let them go to bed because something bad will happen. Sleeping in and of itself is not, it doesn't cause any brain problems. Now, someone that hits their head in the middle of the day and shouldn't be sleeping and all of a sudden is drowsy, that's to be concerned. But a kid that hit his head 30 minutes before bedtime, in 30 minutes, he's probably going to be tired. What I would encourage you to do is monitor them right up to the point where you think they should be going to sleep. When they go to sleep, in 30 minutes or an hour, wake them back up and just ask them if they know who you are, if they know what things that they should know. Do they know their address? Do they know their middle name? Do they know what holiday is coming up next? And if they do, their mental status is probably okay. And then maybe in an hour, do it again. And then maybe in 2 or 3 hours, do it again. You're just checking for mental status changes. The danger in sleeping is that you can't see mental status changes. So if they do have a brain bleed, now you've missed it because they don't have the mental status changes because you can't ask them because they are sleeping. So that's the danger of hitting your head and then going to sleep right away. The sleep is not dangerous. It's the inability to notice mental status changes. So with all this, I want you to feel comfortable going from witnessing a problem to becoming a first responder. I want you to go get some actual real training where you put your hands on this equipment. I hope this has sparked a desire to do this. Do not wait. We don't get a chance. We don't become ready. We prepare ahead of time and then respond. You don't all of a sudden get some magical skills and you watched, Grey's Anatomy a bunch and now you're good to go, or you watch Chicago Fire, now you're a fireman. It doesn't work like that. Lots of training, lots of thought, lots of practice, but you can be ready. So I hope you've enjoyed this. I hope you never have to use anything I've talked about, but I hope you prepare to do that. This is the Earn Your Title Podcast, and I will talk to you later.